This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. Welcome to the latest edition of Mon Health Live, 104.5 FM, 1440 AM, WAJR. We're glad that you have joined us, and we're getting the information out about what you need to know with COVID concerns, vaccine updates, and we'll talk a little bit about the variants today as well. Dr. Crystal Atkinson, Chief Nursing Executive of Mon Health Systems, is with us. And Dr. Atkinson, good morning.
Good morning to you, Kyle. How are you?
I'm doing well. Thanks for coming on. We appreciate it. Also, our special guest is Dr. Melinda Cooper, pediatrician and primary care provider with Mon Health Wedgwood Primary Care. And Dr. Cooper, thanks for your time this morning.
Thank you for having me.
Thanks for coming on. All right, let's jump into some of this news. And Dr. Atkinson, the latest number that I saw of the total West Virginians vaccinated, 481,000. That's a great number. It's a huge number, and West Virginia, as everyone knows, was well out in front of getting people vaccinated quickly, getting them fully vaccinated. But the numbers are down slightly, and it seems like there's more doses at this point than people willing to be vaccinated. So what can you tell us about the latest there and how the vaccination push, for lack of a better term, the vaccination encouragement for people to get it is going?
Yeah, Kyle, thank you for that. I think that we continue to see in our joint efforts, we're so excited to see that the people are still coming forward. But as you said, those numbers can start to dwindle just a little bit. And I think that it's just a mixed bag when we hear, constantly, we're hearing things in the news, and we want to make sure that we're getting the record straight about what has happened so far, what we have available, and, those side effects, right? So I think it's extremely important, not so much from hearing from us, but also for the folks that have actually gotten their vaccines to really be able to share with their friends and family that, whether it's I've had no symptoms at all, or I've had something like maybe I had a headache or I felt like I had the flu. But listen, at the end of the day, I got my vaccination, and I'm, as I continue to go through the process, I'm going to be better off for it. So I think it is extremely important for us to make sure that while we're doing that and we're doing our part, we're sharing that with our friends and our loved ones.
Dr. Cooper, what was your experience with the vaccine, with the vaccination process?
The process itself was run very smoothly. I mean, I was in and out very quickly. I think like a lot of people, I had a little bit of a sore arm, a little achy for a day or so, but it was really not anything that was, anything that was bothersome or kept me from working or doing my normal routines. So for me, it was definitely a big relief to feel like I was finally had that bit of extra safety and protection as I'm seeing patients day to day.
And Dr. Cooper, in your practice, seeing patients day to day, why? What are the reasons people are telling you that they're reluctant to get this, and what's your counter argument to that?
Most people are more worried about the fact that it has been such a quick development and that these are newer vaccines. And what I normally explain to people is that, some of the technology behind these vaccines has been there. They've worked on some other viruses in the past, and they're adapting it to this virus. They've got lots of studies, and I usually will go over the numbers of people, we're into the upper millions of, tens of millions of people that worldwide, countrywide, that have gotten vaccinated, and that we're seeing really good follow-up on symptoms, and they're still tracking. I was really impressed with the Be Safe tracking that the CDC has done. It's continuingly, several months out from my last vaccine, and I still get monthly reminders on how I'm feeling. Is there anything new that's happened since the vaccination? So they're still collecting all kinds of data, which is great.
Dr. Atkinson, all of the doses provided at Mon Healthcare have been Pfizer, and and I had the Pfizer vaccine. I had a little bit of a sore arm after the first dose. The second dose, there was nothing. I hardly even felt it, and I had no side effects. Pfizer seems to be performing very well. There is a concern. There's been some publicity around the Johnson & Johnson vaccine, and in some extremely rare cases of these blood clots. Again, Pfizer, I think, is what most people in this region have had. What can you tell us about these, again, extremely rare side effects that people, at least no one around here, I don't think, has experienced, but on the national scale, there's been talk about some of these side effects.
Yeah, thanks, Kyle. So, again, yes, we have only been administering Pfizer, and I do think as we kind of take a step back, right, we had 3 different companies come forward and just saying, hey, listen, we're willing to do this. At the point that we had the ability to be able to receive vaccines, we had open arms on whomever came forth first. So Pfizer happened to be the winner as far as that's concerned. But I think you raised a really great point. The side effects are just really extremely minimal, and when we keep hearing about it, certainly it can heighten our concern. But I think that as you are speaking, we're speaking with Dr. Cooper this morning, or any of our physicians, if people are concerned about that from a standpoint of not getting it, I think any physician will share with you that while we're hearing about this, the incident of this happening to you is very rare. And so I think that, again, this is something certainly new to all of us. So anything that's outside of the realm of what we consider to be normal will be challenging. But again, those numbers and the incidence of it happening is very rare indeed compared to the number of people who have been vaccinated and have had no issues.
I think the number was 4 cases of the side effect with the blood clots compared to 6 or 7 million doses administered. So it's literally 1 in a million. It's 1 in a million.
Right, absolutely.
Okay, go ahead, Dr. Cooper.
I was going to say, and if you think about the side effects we're seeing in people with infections, lots more issues with other blood clots, so still a lot less common than even what might experience if you got infected with COVID.
Mm-hmm. All right. The next thing that people are talking about are the variants, and I believe Governor Justice on Friday said that a couple of cases, the Brazilian COVID-19 variant has been detected in Berkeley County. So it's around. It's an issue. I'll start with you, Dr. Atkinson. How worried do people need to be about these variants that we're hearing about?
I think that the term would be certainly concern, especially if we're not following the mitigation processes that have been put in place, such as we speak every week about this, right? Making sure that we're protecting our own immune system by washing our hands, using good hand hygiene, utilizing masks, especially when we're in large crowds, social distancing, and as we're talking about today, moving forward with steps to be able to get vaccinated.
Mm-hmm. Dr. Cooper, anything to add?
No, I think that covers it. We just have to keep doing the things and not let our guard down too much. I think where some people are, feeling like, okay, we're in the clear, but we still have to be cautious until we have enough of the population protected.
Mm-hmm. And Dr. Atkinson, the vaccine is still very efficient, very effective against these variants. Now, there's no guarantees about anything in life, 100%, but the vaccines have proven to be productive against these variants.
Correct. And I think, again, that is our best line of defense. We've got the scientists that are retrieving data every day. And of course, we will certainly make changes in course as they share with us that there's need to be able to do that. But at this point, there's been nothing that has been shared with us that is not making us feel very comfortable with the vaccines that we are currently being distributed that don't have the ability to be able to help fight off this variant.
Okay. Dr. Cooper, young people in the vaccine, real quick before we take our first break, I believe the doors have been open for anyone 16 or older to get the vaccine, and I know there's been a push for high school students to get the vaccine. What can you tell us about that and younger people in this vaccine?
Yeah, they did their initial studies, anyone 16 and over, so I think we're seeing, cases, we're hearing about them in our local high schools. So as much as we can get the teenagers protected, the better. And, there's talk of hopefully down the road, not too long, maybe even being able to go younger than that. And I think these vaccines have continued to show that they're safe and effective in any age group that we've seen so far.
Mm-hmm. And again, real quick before our break, talk about the protocols that are in place at Mon Health Wedgwood Primary Care. We've talked each week about how protected the hospital is and the protocols in place. What about your facility?
So screening for anybody, even when they're making appointments, to make sure they haven't had any recent exposures, and if so, we're making telehealth visits and place it in person. When they're coming in the door, having temperature checked, having a questionnaire about any recent exposures or pending tests. So we're taking those precautions. Everything's being cleaned on a very frequent basis. Beds and rooms are being wiped down throughout the day, even. We're doing all these things that we can do, and I think we've been very fortunate so far. Everything's gone very well.
All right, very good. We are with our special guest, Dr. Melinda Cooper, pediatrician and primary care provider with Mon Health Wedgwood Primary Care. And, of course, we will continue the conversation with Dr. Cooper and also with Dr. Crystal Atkinson joining us on Mon Health Live on this Saturday morning on WAJR.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
And we are back on Mon Health Live. Kyle Wiggs with you and David Goldberg off on this Saturday, but we are joined by Dr. Crystal Atkinson, Chief Nursing Executive of Mon Health Systems, and also Dr. Melinda Cooper, pediatrician and primary care provider with Mon Health Wedgwood Primary Care. And ladies, welcome back to the show. We appreciate your time on this Saturday morning.
Thank you.
Thank you.
Dr. Cooper, we understand that Mon Health Wedgwood has won Best Healthcare Clinic again by West Virginia Living Magazine, and that's kind of become an annual event or an annual award for you all. Congratulations.
Thank you.
What do you think sets your operation apart?
I think what I've experienced here since I started here a year ago is that, the care that we continue to provide is very much focused on the patient, and, not just seeing people as numbers and getting people in and out, but we're focusing on them and their best interests.
Mm-hmm. I understand that Dr. Kolenko has retired. Now, I raised two kids in this community, and you can't go very far without encountering a parent or encountering a child who had wonderful dealings with Dr. Kolenko. So 30 years with him serving the community, that must have been a little bit of adjustment life without Dr. Kolenko.
It sure has. We certainly miss him already here, but I've heard already from a number of patients that the kids have seen him since they were born, the parents had seen him since they were born, and yes, he was really a fantastic provider and great to be able to work with. And I've told all these patients that I'm seeing now taking over from him that I've got some big shoes to fill, but I'm excited for the chance.
Yeah, for families looking for a primary care physician or for a pediatrician, can they give you a call? What's the process of getting set up with an appointment?
Absolutely, yes. So I'm board certified in pediatrics and as well in internal medicine, so I can see the whole age group. But to get an appointment with us, I can call our main clinic line at 304-599-9400. or even online at monhealth.com/primary care.
Mm-hmm. Okay, and you offer lab work and x-ray services right there, correct?
We do, yes. We can do that on site, and I even have late appointments one day each week. Changes days of the week, but I'm here at least 8:30 to 5 most days, and sometimes as late as 9 on my late days. Okay,
you mentioned telehealth. How much has changed the last year with this pandemic in terms of telehealth being at the forefront? Is that something that you offer and that you recommend to patients who maybe are a little bit leery about coming in the office?
Yeah, Yeah, absolutely. We can do telehealth visits for most things. There's a lot of things that we can do just through telehealth and getting the history, talking to the patient. There are some times where it is really more critical to be able to have them come in to be able to check vitals or to do an exam. But a lot of times we can do that as a telehealth. And we've had a lot of people that have, preferred to do that until they've gotten vaccinated, which is fine. And when they're scheduling, they can just request that, and they make notes, and then we'll take care of getting them connected when it's time for their appointment.
All right. Again, that number, 304-599-9400. That is the number for Mon Health Wedgwood Primary Care. All right, doctors, back a little bit on topic here, and we talked about the variants a little bit in the previous segment, but the variants seem to be affecting younger and younger individuals, children in a lot of cases, some as young as 6 years old. So, Dr. Cooper, let's continue with that discussion as to why this variant may be affecting the younger population.
Sure. Yeah, we're seeing more of this now. We're still seeing quite a varied presentation in terms of degree of symptoms, some having no symptoms, some having more severe cases. But, our younger kids may not have, their body may have not seen a similar virus to some of these variants, and so there might be having more severe symptoms. The more now that kids are getting out and about will help that we're not indoors all the time, but we still have to be really cautious and really talk to them a lot about mask wearing and hand washing.
Dr. Atkinson, anything to add?
No, I think Dr. Cooper said it beautifully.
All right. What about the psychological aspect of this? As you mentioned, Dr. Cooper, a lot of people, a lot of young people have kind of been inside all winter, and they've been kind of isolated, so to speak. They haven't been at school perhaps as much as they would like, and extracurriculars have been curtailed and cut back. What's the role of a physician there in helping a young person kind of come out of that after what's been a very, very long winter?
Sure, yeah, we have seen a huge increase in mental health across all age ranges. I think adolescence is definitely a key part of that. As the primary care doctor, I like to, see how much it is affecting their everyday activities and life, and see if we can find ways that we can help them. A lot of times just with some simple things that we can kind of change in our daily activities with trying to get outside and finding ways to reconnect. It has definitely presented a real challenge for many of us.
So if there's someone out there listening, a parent or a grandparent or a caregiver of a youngster, and they're seeing some changes in behavior, or they're a little bit concerned about some things that have been happening, what's your suggestion to them?
I think definitely, have them seen by their primary care doctor and get them in so that they can talk about it, because oftentimes we don't always talk as much. A lot of times teenagers too, they tend to be hold things more inside and not always open up about how they're feeling. And so I think having a third party to be able to talk with them and to see what else we can do for them and what might be the best treatment options is critical.
Mental health a concern, and obviously physical health a concern. We talked a lot about the vaccines in the first segment as well. And Dr. Cooper, what can parents and grandparents and caregivers do to help protect children who aren't yet old enough to get vaccinated and aren't vaccinated yet?
Sure. Yeah, as many of the people in the household that are able to, obviously that's going to provide that many more people around the younger ones that are not able to pass the virus on to them, we would think. So, every chance that we can do, it prevents that snowball effect. It just takes one person close to you to have symptoms, but if we're keeping everybody around our younger ones protected, then we're going to keep them safe as well.
And this is a question for both of you. Why is it important to have a primary care doctor and to continue to see your doctor? Dr. Cooper, we'll start with you. Would you encourage people that, again, may be reluctant because of this pandemic to get out to the doctor's office or to the hospital? What would you say to encourage them?
Well, like I said, we are doing lots of things to ensure that patients are safe and protected here in the clinics. And I think we need to really make sure that we are not putting our health behind. We need to make sure for our young ones that we're still making sure they're developing appropriately, and especially with the school changes, making sure that their emotional well-being is also being addressed. And for our adults, also making sure that we're doing the other preventative types of things we need to be doing and taking care of their chronic health issues. We can't let that fall behind.
Mm-hmm. Dr. Atkinson?
Yeah, and I think as Dr. Cooper has shared, it's so important just to make sure that we're coming to our physicians' offices, and sometimes it's that one little conversation that you're having with your primary care physician that you may not think it's anything and it's been bothering you, but they can hone in on that, and it may be something that will lead you to a specialist where they certainly have that knowledge base and they know across all specialties who would be the best person to be able to take care of something that's bothering their individual patients.
Mm-hmm. We got about a little bit less than a minute left in the show on this Saturday morning. Dr. Atkinson, for those, again, people who are reluctant to get the vaccine, many of your neighbors, if not most, have already done it. What would you do to encourage people to take that step and get the vaccine?
I think certainly asking the question, of people who've done it before and just saying, okay, tell me about your experience. I think on the flip side, again, people who know that they have people, whether they live with or they're close to in their communities, just share that good news of how easy it was to be able to get an appointment, the process for being able to get in and out, and then, whether they had side effects or no side effects at all.
All right, very good. Great information as usual, Dr. Crystal Atkinson. Thanks for your time, and Dr. Melinda Cooper, we appreciate your input as well.
Always a pleasure. Thank you.
That's Mon Health Live for the Saturday morning, 104.5 FM, 1440 AM, WAJR.